Hi everyone, how's it going? I'm Rachel and welcome back to Conversations with Dental Friends, the go-to podcast for dental professionals who want to grow, innovate and take their careers to the next level. Today I'm joined by Gemma Forsythe, a dental nurse who has truly flourished in her role, so much so that she was crowned the best dental nurse in the UK. Gemma qualified as a dental nurse in 2020 and is currently working at McGee Dental Practice in Lurgan, where she's absolutely thriving. But what really sets Gemma apart is how she's embraced every opportunity that's come her way, showing just how exciting and fulfilling a career in dental nursing can be. If you're thinking about becoming a dental nurse, looking to expand your role within or beyond the surgery, or just want to hear from someone who's making waves in the profession, this episode is for you. Let's get into it. Hi there, Gemma.
Hello.
Welcome to Conversations with Dental Friends. Thank you so much for joining me today, Gemma. I know Gemma mostly through social media and her involvement in some speaking engagements at the same event. And I just thought Gemma would be a really interesting person to have on as a great inspirational person that can give us some really, really good advice as well. So Gemma, let's start with your journey. How did you first get into dental nursing and what's your career looked like so far?
Well, thank you so much, first of all, for having me on the podcast. Delighted to be asked. Sure. My career in dentistry started, I was actually working in a care home.
Okay.
And it was residents with mental health, learning disability, physical disability. Like, a lot of them were non-verbal, things like that. So it was quite challenging, but it was the most rewarding job I think I've ever had.
Absolutely.
I worked there, it was 12-hour shifts. So it was very
long day
and hard on family life as well.
Physically demanding.
Very. And my son was quite young at the time. So whenever he was going to bed, I came home after that. Didn't see him. I was leaving in the morning before he got up. You know, it was quite hard not seeing him as much as I'd like to. So
absolutely.
I knew that I loved the job and I loved what I did, and it was so rewarding and so good for me. But I also knew that I kind of had to do something, because although I loved it, it wasn't working for me. So I was on the lookout for something else in healthcare, because I knew I was good with people. And something sort of 9 to 5.
And lots of transferable skills.
Yeah, exactly.
Within that field.
So I seen a job come up for a trainee dental nurse in a local practice, and I just thought, I wonder, should I try that? Because I've always kind of been curious about it. Well, I was never scared of the dentist or anything, but never loved going either. But I remember being at the dentist, like looking at dental nurse, being like, what is it they do? You know,
who is this mystery person?
So I applied for it, didn't think I would get it. But I think, as you say, the transferable skills in the interview, I think that's what got me it. Because I was able to explain how I support people and how I reassure them and make sure, and all of them transfer into dentistry, cross-infection, transfers.
So I didn't even think of
I got the job and I haven't looked back. Honestly, it's been the best thing.
And when did you qualify from dental nursing?
So I qualified in 2020.
2020. So right in COVID.
Yeah.
A baptism.
I know.
I know. I feel for anybody that moved into dentistry in that time. I definitely do. So you were in practice first as a trainee.
Yeah.
How did that work for your training? Then you were in practice, but also you went to classes.
Yes, so I did a course SRC Portadown. So it was the NABDN National Diploma in Dental Nursing, and it was one night a week.
Mm-hmm.
So I would have worked 5 days and went there then one evening after work from like 6 to 9. It was a lot. So then I ended up taking then a day off a week after that, because I was like, that's just crazy.
Because there's so much work you have to do around that as well.
Studying and doing coursework and doing your ROE, that's another kettle of fish altogether. It's just crazy. It's so much work. I don't think anyone realised how much work goes into actually qualifying as a dental nurse, to be honest.
It is beyond, and I think the syllabus is so vast.
It is.
That to actually, whenever it actually comes to doing your exams, there isn't that kind of always wealth of past papers where you could do 6 past papers and you've completed all the questions. There's that massive amount of scope there that you need to know as a dental nurse, whether you're examined on it or not.
You just don't know what's going to be on it or what's going to come up. So you just need to learn everything.
You do.
Which is so much.
You do, and it's in quite a lot of detail as well. It's
Like, you wouldn't believe how much hygiene, dentistry, dental nursing all cross over, how much you have to learn that maybe you don't need to know in practice, but you need to know for the exam.
Yes. So you qualified then in 2020 and you are now working in practice.
Yeah.
Can you tell me a little bit about where you're working at the minute?
Yes, so I work in McGee Dental Care in Lurgan.
Great.
So it's a big practice. We have 7 surgeries and we have quite a few clinicians, quite a few dental nurses, and we have a big team, but it's a lovely team and we all get on well and work well, and it is really, really good to work there. I've been there from 2021 and I'm very settled. I'm lead decontamination nurse in there as well.
Brilliant.
Oral health educator, mental health first aider, the list goes on.
This goes on, Gemma. I had no doubt. I was just going to say, what's your role in the practice? But I had no doubt it would be extensive.
Yeah.
So that's really great. And you love your time, obviously, as a dental nurse in surgery and in practice. Alongside that time, you've also built a really brilliant social media presence. What made you decide to create that professional Instagram account, Dental Nurse Gem, as a dental nurse? And how has this experience been for you?
Well, when I first started, there was very few dental nurses on Instagram, but see now, there's so many, and I think it's great, yeah.
Oh, really?
But I didn't start it originally for that. I basically qualified as an oral health educator in 2021, straight after my dental nursing, and I was dying to get into schools and to get out to tell people about how to look after their mouth and how to keep them healthy, but obviously I couldn't because COVID.
Yes.
And so I was like, right, I'm going to make this Instagram and I'm going to put out oral health messages about brushing, bleeding gums, all this stuff that I'd learnt. And so it started off like that, but then it just progressed into promoting dental nursing and how it's like a career in itself, and it's not just a stepping stone. And I'm really passionate about that. Yes, because so many people just see it as kind of like you just jump over it.
Exactly. And there's so much to give as a dental nurse. And I think that's really great that so many dental nurses are now moving into that social media space and creating that awareness of what a great job it actually is. You've had some amazing opportunities, Gemma, in your career so far, and I'd love to dive into a few of them with you if you'd like to. First up is writing. I love writing. I feel like it's such a brilliant way to get your messaging across. It's definitely for a certain sort of person. I love writing articles because I love reading articles. Yeah. You've had articles published on dentistry.com, which is incredible. Is writing something you've always been passionate about? How did you go about getting your work published with FMC?
So it started back when I started my Instagram and I got recognised. I think I got a message from Dental Nursing Journal to begin with.
Okay.
And they had kind of said, would you be interested in doing an article just about your career so far? And I was like, of course, yeah. Didn't have a clue where to start. Had never wrote anything before. Probably the last time I wrote something was English at school, so a long time before. I wrote this article and I remember reading out to my mum, reading out to my dad and making sure it was all perfect before I sent it over. And I remember seeing it in print for the first time and I was like, wow, this is class. I can't believe this happened to me.
Such an achievement.
And I remember going around showing everyone and bringing into the practice and all going, like there I am. And it's kind of led to me being on the editorial board of Dental Nursing Journal for the last 5-6 years.
What?
So a long time. And then FMC had got in contact with me in, I think it was August 2022. And they had said, look, we want to do a dental nursing section. Would you be interested in taking it on? And I got to help come up with the name and everything, which was Nursing Matters, which I think is a great name for it. Yes, because nursing really does matter. But it's about matters to do with dental nursing. So I thought the double meaning was quite good. So I started that and done that for 2 years. Just finished there in August 2024. And I really, really thoroughly enjoyed it. I talked about so many different things that you would never think was to do with dentistry, like STIs. I'd done like an STI special for Valentine's Day, you know, how, the oral manifestations of that. And I'd done about LGBTQ plus rights and how that can manifest itself in dentistry, and about stress and mental health and all these different things. Wonderful. So it was really great to tackle these subjects. And I think towards the end, I just kind of thought, my passion's dwelling a wee bit for this, and
you have to really
yeah,
because you can see that in writing if you're not feeling 100% passionate about it.
exactly. And I thought it was getting harder to come up with topics, and I was just like, do you know what? I think it's better to stop it while I'm on a high than to be putting out work that I'm not happy with and it's not perfect.
I love that, Gemma, absolutely. And I think that it's hard after 2 years. Was it a weekly?
It was monthly.
A monthly.
Yeah.
So that's 24 topics. That's a lot of writing, and to stay fresh and relevant and keeping readers engaged, which she obviously did. And it doesn't mean that there will be no more writing of it in the future. Of course, you can use that and have that as such a badge of honour that you've been involved in such a great opportunity. That's fabulous. You're also a disability champion in partnership with Oral-B, which is such an important role. How did that opportunity come about for you, and what does that role involve?
Yes, so I think this stems back to my time in the care home, because I'm so passionate about accessibility, and they came up with this initiative, which I think is great, that they want someone to champion accessibility and equality of people with disabilities coming into dentistry.
And that is a very real issue. If you think about some of the buildings that dental practices are in, they're upstairs.
Yeah, some of them are so old as well that they can't fix that because they're listed and things like that. I think I read a statistic, it was like 35% of disabled people get really frustrated and anxious going to the dentist because of the accessibility.
Oh.
So I was just like, no, do you know what? I think we should do this. So I had to put together this portfolio of, our building is very big, purpose-built, modern, accessibility on all floors because we have a lift and things. So I was like, right, we've got that covered. I had made these booklets as well for autistic patients that would explain like what's going to happen in what order. All these pictures that were laminated because it was during COVID, so we can wipe them down and things. And it's just something like that can make someone's visit so much more.
It really for them. And also that person that is their caregiver.
Yeah.
Because I used to be an ABA therapist for autism, and we talked a lot with the child I work with around key visits in the community, like getting your hair cut, going to the dentist. And I know that would be so well received, not just by the patient, but by their team of close people that's with them. So I think it's amazing.
I just think it's frustrating and it can make you anxious going to the dentist with nothing wrong and like no disabilities, whereas someone with, say, autism would really, really, really be overwhelmed and struggle with it.
Absolutely.
So I put together that portfolio and sent it off, and they came back and approved us then. So it means that if someone that has disability wants a dental practice that has this disability champion, they can look it up and see the closest one. So we'll be listed on that then.
That's wonderful. That's wonderful. And that's maybe something that you could roll out as well to other practices within the community. I'm sure so many people would be interested in making sure that their practice was a warm and welcoming place for anybody with a disability. So I think that's absolutely fantastic. Gemma, in addition to your writing, you were also a speaker at the Irish Dentistry Show last year, which was a fab event. Of course, the sun was split in the skies. It always is. And you were talking about domestic abuse, and that's such an important conversation. How was that experience for you?
I loved it. It was great. I really, really enjoy speaking, and I actually enjoy putting together the presentation.
It's really fun.
I think it's great. I'd spoke before, and it was about patients with additional care needs. So it was autism, ADHD, and dementia I'd chosen for that, and it was kind of a more happy one, whereas this wasn't the happiest topic. So it was harder to kind of convey through a PowerPoint, I feel like. But I hope I did it justice. I tried my absolute best. But I just think as dental professionals, we're in such a unique position in that we can notice things that maybe other people can't.
Yes.
And I think that because you're in sort of a more private setting as well, you can kind of probe the person and ask those questions and feel confident in it. So I was trying to give dental professionals the confidence to go that extra step and question things that maybe would help that patient going through this.
A bit of a cheat sheet or a blueprint maybe when you're in surgery, because I suppose us as dental professionals, quite often I see patients a minimum 4 times a year. You're maybe going to see patients even more than that again.
Yeah.
And you do really build up that relationship. It's the people in the room. If you're in there for a big treatment plan, you're going to spend a lot of time with whoever's assisting in the surgery as well as the clinician themselves. So I think that would have been enormously well received by...
It's not the dentist. Sometimes whoever you're working with, dentist, clinician, whoever it is, can spend so much time focusing on their mouth,
on the task.
But you're sitting there noticing, like I can always tell, be able to tell you what shoes patients wearing. You're so observant in that role that you can never not think about yourself as important in that situation to safeguard your patients.
That's lovely. I think that's really, really important messaging, and I hope that loads of people took so much away from that experience. What steps, if you say were a dental nurse and you felt like you would enjoy moving into that space of a speaking engagement, what advice would you give to somebody who was maybe wanting to get started in that space or wanted to do that a little bit more in addition to their clinical role?
I think definitely the social media has helped me along that way.
Yes.
Like, if it wasn't for that, I probably wouldn't have been recognised, wouldn't have got to that stage. But you know what? It's putting yourself out there. I spoke at it was the North of England Dentistry in Manchester in 2022. They had their first ever dental nursing hub. So I was sticking there, and I remember, yeah, it was great. I was so delighted they had a nursing hub. I just thought it was brilliant initiative, and I was so happy that they did that. But I had just turned around to them and said, look, I want to bring this to the Irish Dentistry Show. I think this is a really good topic, and I think that I should speak. And they were like, okay. We just have to go out and be like, I want to do this.
I think so much of it, Gemma, is bravery and putting yourself out there, because whenever you put yourself in those situations, I find that people are very, very receptive.
Yeah.
And they are excited about something that you're excited about.
Exactly.
And I know that you said that you have been approached in ways, but that's not always the case. And I think letting somebody know, putting yourself on their radar to say, hello, I'm interested in this.
Yeah.
I'd like to do it. Because there's not many people that are putting themselves forward. There's actually a very small pool of people to choose from, which is why sometimes I think it feels like there's always one person that gets picked for every opportunity.
Yeah.
But it's not that one person necessarily is getting picked. It's that there's not other people
that don't know about other people
coming forward.
Exactly. But you know what? You don't ask, you don't get. You just have to do it.
You have to.
It is.
I think Reese Witherspoon said something like that. I remember watching an Instagram reel about it, and she said that you need to knock the door, and that really resonated with me, and you just have to stay yourself on those occasions. So out of all of these amazing extracurricular activities, writing and speaking and advocacy, if you could pick just one, Gemma, if you had to pick just one, what would be your favourite, and why is it your favourite?
That's the hardest question, I think.
Isn't it?
Because there's something I love about every single thing. But I would probably say speaking, only because my mum and Tyler got to come and see me, and I just thought it was great. You know, Tyler is at that age now, he's 13. And so many people said about it to me that he had my phone and he was taking videos and he was taking photos and he was getting the angles, and I just thought, like, he was so proud of me.
Yes.
And I was like, I want him to grow up and know that he can do anything.
Exactly.
And you need to strive for what you want, and that's what I do. That's what I try to do. And you know what? See, if you want to do something, you can do it.
Yes.
You could look at me. I'm up speaking at a show. I was the only dental nurse there speaking. So you can do hard things.
You can put your mind to anything, and everything is figure outable.
Yeah.
If you want to do something, there will be a way to break it down into steps where you can achieve that. And I love that. Gemma, I think sometimes, we touched on this already, but I think sometimes there's pressure in dental nursing to move into other areas, whether that's the management side of things, where you take a more active role in the welcome team and treatment coordination, or you decide to move into dental hygiene or dental therapy or even dentistry itself. But dental nursing is such a great career, and we have so many fantastic dental nurses. I've certainly worked with loads and loads of people that have really been excellent, and it's such a great career in its own right. What do you love the most about dental nursing?
I think you're completely right. It's such a valuable career, and I think a lot of people do see it as do this for a while and then move on. I've had actually patients turn around to me and say, "Are you training to be a dentist?" I'm like, "No, I'm a dental nurse. It's the job." And I'm sure a lot of dentists, therapists, hygienists will tell you a good dental nurse is worth their weight in gold.
I could not do my role without having that person in the room with me. And whenever you are in a flow with someone who is assisting you, your day is
such a breeze. I know.
It's unbelievably good.
I think so. And I think it's so important for the same nurses to be working with the same clinicians. I think that relationship
I think that is
so important.
I think that as well. That's definitely my preference.
Yes. And see, when you work so well with someone and you're like a well-oiled machine and you're just passing things back and forth, and it's just so like clockwork. You don't have to think about what you're doing. You know, as a nurse, what they're going to do next.
Yeah.
They know what to expect from you. And I think it's just so important. But I think patients need to realise you wouldn't have instruments.
No.
You wouldn't have the surgery set up. You wouldn't be able to get your treatment done. They're so important.
It's 50%, if not more, of the appointment.
Yeah. But the most thing that I like about it would probably be nervous patients coming in, and when you can see them coming in every time, you're building that relationship and they're coming in every time less and less nervous.
Yes.
I think that is such a nice thing. I think that is just the most rewarding thing about the role.
It's a gift you're giving to someone.
Yeah. And it's no one's favourite place to be. As a dentist, no one enjoys going there. But if you can make their time in the chair a wee bit easier, like your job's dodgy. But I also feel like I think it's nice getting like praise from the dentist. Because if they tell you, "Oh, like I couldn't have done that without you," you're like, "Thank you so much." It means so much because you're doing your job well and they're telling you.
Yeah. And I think that within dental nursing itself, there are opportunities for progression, like things that you've already done. And if you did want to go into giving back to the dental nursing community and doing some teaching, would that be something you would be interested in doing?
That'd be great. Yeah. I do take on that role in our practice. I would mentor the trainees, that is, help the new starts know what to do and where things are and things. But yeah, teaching would be, it's probably what would be my next goal, I would say.
Yes, and I think you'd be so good at it.
You'd
have so much to give. You would have so much to give, Gemma, and you're so engaging. I think people would learn a lot from you, absolutely. Now, Gemma, we've talked a lot about your platform, Dental Nurse Gem, and the amazing community you've built. And we were saying at the beginning that there are a lot more nurses now using a professional Instagram account. Would you recommend that to other dental nurses, to create that Instagram to help take their career to the next level?
I would recommend it. I wouldn't have had half of the opportunities that I've got without mine. I started mine quite a while ago, but I would, if someone's thinking about it, absolutely go for it. You know, you just don't know where it'll take you. And I would say make sure you're posting about things you're passionate about. Don't feel forced to push things that you don't want to post,
or that are trends,
or that you think will make you grow, because the people that follow you will follow you and stay if you're posting authentic content that you enjoy, and people can tell if you enjoy it, I feel like, as well.
Yes.
So as well as the educational, I have a lot of, dental people follow me, dentists, other nurses, things like that, and they say they're inspired.
Yeah.
So I think that's lovely too, that other dental professionals are inspired, as well as patients learning from your platform.
Because oral health education transcends so many areas of dentistry. It's not just, I would always sort of think of myself as an oral health expert, oral health champion, but dentists, dental therapists, dental hygienists, dental nurses all play that role within practice. And to get your message out there to as many people as possible is kind of like our life's mission, or kind of like Jay Shetty Dharma, to help people.
Exactly.
That's my life's goal, and I feel like you have that passion as well. Do you think there are certain things or certain structure to posting that you try to follow, or does it happen more organically on your page?
I used to kind of post like certain days of the week, but now I just post when I want to post. I post what I want to post, and that's just the way I've kind of grown. I just feel like when you put too much pressure on yourself, it doesn't become a hobby anymore.
Yeah.
And that's when I was like, no, I enjoy this. It's what I do on the side. It's not my work. So I want to make sure it stays a hobby and it stays enjoyable.
I think there was a time, wasn't there, whenever it very much mattered what the grid looked like when you went onto the page. And I remember I was sort of a bit obsessed with that. And it needed to all be before and afters, and then it needed to all be a post, and then a post all had to have the same font,
So it was all
same
aligned.
background,
Yeah.
and it basically had to look like a 14-year-old's bedroom, 14-year-old girl's bedroom. I was surprised mine didn't have bang on the door.
Gravy check.
Oh, gravy check on the border. But if I missed that, I nearly felt like I couldn't post for the week because it would mess up the grid. And I missed lots of good opportunities to post. And I've also sat on a lot of content. Do you ever feel there's imposter syndrome around what you're going to post?
Big time. I sometimes, if I were to post something, I'm like, will people look at that and go, who does she think she is?
Yes.
But at the end of the day, they're following you for a reason. Even the people who don't follow you, they can talk about you. That's fine. Just let them. And it's none of your business what they talk about or what they say or what they think about you. Because if I didn't think like that, I would never have posted anything.
Yes.
And I have had people talk about me before previously, and I'm just like, that's okay. That's fine.
Yeah.
That's your business, not mine.
Look what you're doing.
Yeah.
Exactly.
Focus on your own.
Look at what you're achieving. Look at the trajectory this has set you in, because things can be a bit of a slow burner with Instagram, and it's nearly like an aeroplane. You set the course, and it takes a little while for the nose of the airplane to turn round. So you need to believe in yourself that post that got 4 likes is still relevant.
Yeah.
That post that got 4 million likes, the big wave of that will pass.
Yeah.
You need to, as you say, authentically do it for you as a hobby.
Yeah.
When you're in a good mood.
Exactly.
When you're enjoying.
And you never know, them 4 people may have got really inspired or really learned something from your post. So, and I always think about whenever I started and I was doing the oral health messages more, I was thinking if someone didn't go to the dentist because they were scared or because they didn't want to, and they've seen that and that helped them with their oral care, that's amazing.
It made them pick up the phone and make the appointment.
Yeah.
That you've achieved everything you want to achieve from the page. So I think that's wonderful, and I would love to see more dental nurses, particularly the dental nurses I know, starting up their own educational platforms and spreading the word about how great it is to be a dental nurse, because we need more good dental nurses, and we need good dental nurses to stay dental nursing.
Exactly.
So I think that's fab. And finally, Gemma, what is next for you, and what does the future of your dental career look like?
You can answer that quite well. I was going to say, it is very bodate. I'm enjoying at the minute helping with the compliance, the lead decontamination role. I enjoy doing all that sort of stuff, that end audits and everything like that.
I imagine that's very therapeutic, and also there's a real rhythm to that work where you need a long period of time to just get your work done, and at the end of it, it feels great to have completed.
Exactly. And I spend time in surgery, and then I'm like, you know what, it's nice having to be back doing this. And I do our practice social media as well, so it's coming up with all that content.
That's a lot.
It's a lot, yeah. I don't know where I get the time.
I don't.
But yeah, I really enjoy that sort of role. Because it's so much different to post on my own Instagram. And so I've enjoyed that, and it's really helped me brush up my social media skills and my editing skills and all that sort of stuff. Yeah.
That's really good. And you mentioned there that you would like to move into the educational space. Yeah, that would be huge. So I think that is so exciting to see what's next for Gemma. I know that it will be great. And you can keep in touch with Gemma, of course, on Instagram at DentalNurseJ.
Yep.
And let Gemma know if you are an aspiring dental nurse that would love to connect. I'm sure you'd be very, very happy and delighted to help our lovely dental nurses that we have here. Thank you so much for taking the time to speak to me today. I really, really appreciate it. Cheerio. Bye. What an incredible conversation. I honestly could have talked to Gemma all day. She's just so inspiring and doing amazing work to elevate the role of dental nurses within our industry. Gemma, thank you again for being part of Conversations with Dental Friends. If you would like to connect with Gemma, you can find her on Instagram at Dental Nurse Gem. Whether you're a dental nurse or working in dentistry in any capacity, she's full of brilliant tips and advice for both patients and clinicians alike. If you enjoyed this episode, don't forget to like, follow, rate and leave a review. It helps other amazing dental professionals find this podcast. And if you really loved it, send it to a friend or a colleague who'd enjoy it as well. You can also keep up with everything Conversations with Dental Friends over on Instagram at Conversations with Dental Friends. Come say hi there and let me know what you thought of today's episode. You can also find me on Instagram at Homegirl Hygienist. I'm Rachel. Thanks so much for tuning in, and I'll see you next time for another episode.